Chapter 29. Infectious Diseases of Childhood and Youth. The human body has many enemies, large and small. The most dangerous are far too small for the human eye to see. These are the germs and viruses. Not all germs are dangerous, however. Some are highly beneficial and necessary for life, but others are responsible for many serious diseases, such as bronchitis, pneumonia, septic sore throat, tonsillitis, tuberculosis, and abscesses. Diseases even more dangerous are caused by viruses, organisms considerably smaller than germs. Indeed, they are so small that they can be seen only with the help of a powerful electron microscope. Fortunately, most virus diseases strike a person only once. In recovering from the disease, the body builds up resistance or immunity to the organism. Doctors take advantage of this natural mechanism of the body by using various vaccines, serums, and antigens to protect against certain serious diseases, such as polio. As time goes on, more of these protective vaccines will be produced. Today we are able to protect most children against such serious diseases as diphtheria, whooping cough, and tetanus by using the well-known DPT injections given to babies during the first few months of life. For further details, see page 188. Protection is now available against polio, either by using the live vaccine or the Salk injections. Children can be vaccinated against smallpox and other contagious diseases. These protective measures mean that most children today have a far greater chance for better health than ever before. Parents should certainly take advantage of this newer knowledge to protect their families against unnecessary illness. Chills and fever. Normally, the human body maintains an even temperature of somewhere around 98.6 degrees F, whether the weather is hot or cold, dry or wet. This wonderful temperature regulating mechanism is located F15. 216 infectious diseases. In the base of the brain. As long as a person is in good health, it operates smoothly and efficiently day and night. Slight variations of temperature are not significant. One might have a temperature of 99.2 degrees or 97.8 degrees and still probably be normal. But a sudden attack of shivering, plus a sense of coldness and pallor of the skin, may be the first sign of infection. As soon as the chilly feeling passes, the temperature may begin to rise. The skin may then become hot and dry and remain thus as long as the fever continues. When the fever breaks, there will be profuse sweating as the body cools itself off. Fever is often the first indication that the body is fighting some invading germs or viruses. The fever steps up the body's resistance and is thus beneficial, provided it does not continue too long. Fever may sometimes arise from other causes, such as thyroid problems, tumors, skin diseases, parasites, burns, and other severe. Chills and fever. 217. 218 infectious diseases. Injuries. The temperature may rise because of sensitivity to certain drugs, or because of allergic conditions such as rheumatic fever, rheumatoid arthritis, and many others. In children, most serious infections are usually accompanied by some rash. This helps in making the right diagnosis, a factor important in treating any illness. Medicines that are useful in one condition may not benefit another. Naturally, if the condition seems serious, call your doctor. Meanwhile, here are a few suggestions. Treatment: if the patient is shivering, cover him with warm blankets and apply a hot water bottle, heating pad, or something similar. If the skin feels hot, keep the patient quiet, giving him plenty of fluids and fruit juices, and also some mild aspirin preparation. For a young child, give no more than 1 or 2 grains of aspirin every 2 to 3 hours. Cooling measures, such as are outlined on page 232, are useful in treating a fever. If the temperature is very high, such as 103 degrees F, immerse the patient in cold water, adding ice if available. Hydrotherapy is always the safest means of treating any type of fever. Good nursing care, as outlined in Chapter 10, is most important in treating infectious diseases. Take care of the skin by the daily use of soap and water, using the bed bath technique outlined on page 84. Apply a little rubbing alcohol or similar preparation to prevent irritation of the skin. The patient should remain in bed and be turned frequently to prevent bed sores. Be sure to keep the skin clean and dry. Take care of body wastes, such as urine and stool, whenever necessary. The patient should remain in bed at least 24 hours after the temperature has returned to normal. Light meals, with plenty of fruit juices, are best for any patient with a fever. Measles, rubeola. Measles is a highly infectious disease that usually occurs in epidemics. Most adults have already had this disease. It rarely occurs twice in the same person. Measles usually begins with chills and fever, followed by a hacking cough, running nose and eyes, and a general feeling of weakness and lassitude. After about 3 days, large pink blotches appear on the skin of the face and neck, and also on the mucous membranes of the mouth. The rash looks like pink flakes of bran, and usually spreads all over the body. Measles 219. At the height of the illness, the temperature may go up to 104 degrees Fahrenheit or more, and the child feels very ill. Usually there is swelling around the eyes, and the child may try to protect his eyes from any strong light. He has a deep chest cough and suffers intensely from itching skin. Within 2 or 3 days the fever slowly comes down to normal and the rash fades, leaving a brown discoloration which may continue for a week or more. Complications. Some cases of measles go on to more serious conditions, such as tonsillitis, pneumonia, and otitis media, middle ear disease. One rare but serious complication is encephalitis, or inflammation of the brain. Treatment: keep the patient in bed, in a cool room, and protect his eyes from bright light. Give him some suitable cough syrup, such as that suggested in the appendix. If the skin is very itchy, apply calamine lotion several times a day. Keep the skin clean by frequent bathing. Nose drops are often beneficial in clearing the nasal passages and keeping the airways open. This will help to protect the ears from infection, and prevent other complications in the throat. It is well to call your doctor, especially if the child has a deep cough, for pneumonia is one of the most frequent causes of death following measles. Gamma globulin has proved of some benefit in protecting children who are weak or ill from some other cause. The best treatment of all is to prevent the disease by the use of measles vaccine. This is now available everywhere and all young children should be given the benefit of this full protection. However, if your child has already had measles, there is no point in giving him the vaccine. All other children should be protected in advance. Chickenpox. Chickenpox is a mild disease affecting almost all children during their early years. Many investigators think this rather mild virus disease is closely related to a much more serious condition that affects adults, called shingles or herpes zoster. Chickenpox occurs most frequently in cooler weather, and seems to affect children from 3 to 4 years of age. Infants under 6 months seem to have some immunity against the disease, probably through the mother. In most cases, the older the child, the more severe the attack. 220 Infectious diseases. Chickenpox usually begins with a low-grade fever, a mild headache, and a feeling of weakness. Next day the skin may be flushed and hot. Later small teardrop-shaped blisters appear on the skin, mostly on the upper back or chest. In more severe cases the face and extremities are also involved. Within a few days the skin clears up and the child feels well again. Treatment: bathe the skin daily with soap and warm water. Keep the child's nails closely clipped to prevent scratching, otherwise germs on the skin may be scratched into the blisters, causing more severe infection. Calamine lotion and talcum powder are helpful in controlling the itching. In more serious cases penicillin or some other antibiotic may be needed to control secondary infection of the skin. Smallpox. Smallpox is a very dangerous disease caused by a filterable virus. In past generations it was one of the greatest scourges of the human race, killing hundreds of thousands of people every year. Today, thanks to vaccination introduced by Jenner many years ago, it is rarely seen. But this is no reason to let down our guard. In the first month of life, if its mother has had no vaccination, an infant should be vaccinated against smallpox. By the second or third month all infants should be vaccinated against it because there are always cases of smallpox here and there which may be contracted unwittingly. Vaccination against smallpox should be repeated every 3 years for the rest of a person's life. Smallpox begins with a heavy chill followed by a high fever and prostration similar to a bad attack of influenza. Persistent vomiting and even convulsions are common in small children. The rash usually appears on the third day and is first seen on the forehead, temples, and around the mouth, later spreading to the scalp, neck, arms, hands, and all parts of the body. In the next stage small abscesses or pustules develop in the skin under the rash, and the patient has a high fever and suffers from great weakness. This continues for 8 or 10 days. Healing is slow, and the patient continues for 8 or 10 days. Healing is slow, and the patient feels worn out and exhausted for weeks. Death is common in young children who contract smallpox. Adults who have been vaccinated many years before may still develop a mild form of the disease. Treatment, prevention is most important. Be sure all members. Smallpox and mumps 221 of the family are vaccinated against smallpox. This should be repeated at least every 3 years, and often in area where smallpox is known to exist. Patients suffering from smallpox need good nursing, preferably in a hospital. Penicillin and other antibiotics are useful in treating the pus-filled lesions of the skin. Itching may be controlled by the use of calamine and other lotions mentioned on page 428. The eyes should be treated 2 or 3 times a day to remove the surplus secretion. For directions see page 604. As in all other types of high fever, the patient should be given plenty of fluids and fresh fruit juices. Strict quarantine of the patient is necessary. Smallpox is such a serious disease no family should be without adequate protection through vaccination. Mumps. Mumps is a contagious disease that occurs most frequently in children and young people between the ages of 5 and 15 years of age. Babies are usually immune. Most people have mumps only once in their lives, but 1 person in 10 may have a second attack. This disease is caused by a virus which attacks the salivary glands of the mouth, particularly the paranoid glands located on each side of the face just below and in front of the ear. After a young person is exposed to a case of the mumps, it takes about 2 weeks before he comes down with the disease. Usually he experiences pain on chewing and swallowing, often made worse by swallowing acid liquids, such as vinegar or lemon juice. Painful swellings develop at the sides of the face and below the ears. Glands under the chin may also become enlarged and swollen, and there may be a slight fever. The swelling lasts from 2 to 3 days and then generally goes down. Complication: mumps is usually a mild disease in younger children. During adolescence it is often more severe. In teenage boys, the testicles may be affected, resulting in a condition called orchitis. This is painful and may result in sterility in later life. A far more serious complication occurs when the mumps virus attacks the brain and nervous system, causing meningoencephalitis. Treatment: keep the patient in bed for several days until the temperature returns to normal. Local applications of heat or an ice bag over the affected area will help to relieve some of the discomfort. Use a good cleansing mouthwash to keep the membranes clean. B. 222 Infectious diseases. Sure the patient has plenty of fluids, and preferably a soft diet, such as outlined in the appendix. Soft foods reduce the need for chewing and thus decrease pain. When older boys contract mumps, they should be given 20 cubic centimeters of gamma globulin to protect them against testicular inflammation. Hydrocortisone is also useful in reducing inflammation in the more severe cases. Whooping cough. Whooping cough is a contagious disease that may cause serious trouble in the lungs. At the height of the disease, the patient goes through severe spells of coughing. These often end in a high-pitched crowing form of breathing. The disease is seen less often today because many children are now protected in early infancy by the DPT shots. The P represents pertussis, the medical name for whooping cough. See page 188. An attack of whooping cough may last as long as 6 weeks. It is a distressing disease to both parents and children, and may result in damage to the lungs and bronchial tubes, particularly in youngsters who are not strong. The younger the child, the more serious the disease. Prevention: be sure your baby is fully protected against whooping cough by means of the DPT shots outlined on page 188. If he does develop the disease later, it will be rather mild. Treatment: isolate the child from other members of the family and community. Give him small frequent meals and plenty of fluids between feelings. Vomiting is common after the severe spells of coughing. Good nursing care is essential, especially in children who are weakened through some previous illness. Gamma globulin, 2.5 cubic centimeters to 5 cubic centimeters, may be given intramuscularly and repeated several times if the child is very ill. Milder cases of whooping cough will usually clear up without any permanent damage, but the best treatment of all is to prevent the disease by protecting the child during the early months of life, as suggested on page 188. German measles, rubella. German measles is a mild contagious disease causing few if any problems to the patient. It is also known as 3-day measles, and is more often seen in adolescence and the young adult years. The greatest danger may occur in the case of unborn children if the mother, measles and polio 223, develops the disease during the first 3 months of pregnancy. For this reason, all young girls should be exposed to German measles early in life. Once they have had the disease, they cannot have it again, and thus the hazard associated with having this disease during pregnancy later on will be eliminated. German measles has nothing to do with regular measles. It is caused by an entirely different virus. It is less contagious, and many children do not contract the disease until they are young adults. The patient, usually a young adult or teenager, may complain of a slight headache, stiffness in the joints, and feeling of weakness. There may be slight swelling behind and ears due to enlarged lymph glands. This may be discovered more or less accidentally while combing the hair, and may be the only indication of German measles. If a rash occurs, it is mild and lighter in color than regular measles. There may be a slight flush resembling scarlet fever. The rash itself usually disappears within 2 or 3 days. Treatment: if the patient feels sick, he should remain in bed for several days until he feels better. In the case of complications such as earache, it is well to call the family doctor. Pregnant women should be protected by the use of gamma globulin, particularly during the early months of pregnancy. German measles does not hurt the mother, but it can be serious to an unborn child. It may cause deformities of the heart, mouth, eyes, and other parts of the body. Polio. Poliomyelitis was once called infantile paralysis because of the frequency with which children developed the disease. It is found in all parts of the world and occurs more frequently in summer and autumn. Adults may also develop the disease, although most of them have probably been exposed to the disease during childhood and have built up some immunity. During severe epidemics, the virus has been isolated from sewage, and also from food contaminated by flies or cockroaches. It is a strange turn of events that in countries with a low standard of living, polio is rather rare. Most of the children have already been exposed to the virus and have developed an immunity. In countries with a higher standard of living, the actual disease occurs more frequently because most children have not been exposed during their 224 infectious diseases. Early years. Polio could probably be wiped out completely today, either by the use of the Salk vaccine or the Sabin oral vaccine. In the first stage of polio, the patient has a slight fever, headache, and sore throat. This may clear up entirely in 2 or 3 days, and the patient may then be immune to the disease for the rest of his life. In a few cases, the fever may return after several days. It will be more severe, and there may be headache, stiffness of the joints of the neck and back, as well as muscle pain and tenderness. This may be followed by partial or complete paralysis of some part of the body, such as an arm or leg. In bulbar polio there may be paralysis of the throat and larynx, and the patient may not be able to swallow or breathe without the use of a respirator. However, many cases of paralysis clearly up fairly well, and only about 25% of the more severe cases result in permanent damage. Generally speaking, the older the patient, the more serious the disease. Prevention: young children and pregnant women are particularly susceptible to polio. All families are advised to take Salk vaccine, or Sabin oral vaccine if available. This is given in 3 doses, usually 4 to 6 weeks apart, beginning with type I, followed by type 3, and finally by type 2. Treatment: good nursing is most important in all cases of polio. Paralysis is more likely to be permanent if the patient remains active during the first 24 hours after the beginning of severe symptoms. He should be hospitalized as soon as any paralysis is noted. Most milder cases can be cared for at home. Place a thin plywood board beneath the mattress, above the springs, and another board at the foot of the bed to protect the patient's back and feet. Hot packs, as suggested on page 96, should be applied for 30 minutes several times a day to whatever parts of the body are affected. Because of heavy sweating, the patient will probably need a little extra salt. If he is constipated, use some mild laxative, such as milk of magnesia. If the patient is unable to breathe properly, call an ambulance and send him to hospital where he can be placed in a suitable tank respirator. This will provide him with oxygen and help him to breathe. Such cases are very rare, and the decision to use a respirator must be left to the doctor in charge. Paralyzed muscles may need the combined care of a doctor, a nurse, and a physical therapist. As soon as the pain and fever have Diphtheria 225 subsided, the therapist or nurse should begin both passive and active motion of the affected muscles. This will help to restore normal function and will keep the weakened limbs in the best possible condition. All of this must be handled by the physical therapist under the direction of the doctor. Orthopedic surgery may be needed later to correct any bone or joint deformities, or to reattach healthy muscles as needed. Further suggestions for helping handicapped patients are found on page 430. Certain other strains of virus, including Coxsackie and echoviruses, may produce a similar picture to polio. These are usually milder. The treatment in such cases is much the same. Diphtheria. Diphtheria is a highly contagious disease caused by certain germs occasionally found in the throats of apparently normal people. These are known as carriers of the germs. They do not actually have the disease. Sometimes the germs are found in other areas, such as in open wounds. Years ago diphtheria attacked many thousands of children. It is rarely seen today because many children are now protected by DPT shots during infancy. The D represents diphtheria. Milk and other foods may contain diphtheria organisms, a good reason why all milk for human use should either be pasteurized or boiled. Complications: children with large tonsils and adenoids are more susceptible to diphtheria, especially if they have not been given the DPT shots in infancy. Greatest danger arises from blockage of the windpipe due to infection in the throat. This causes strangling, and the patient may die unless quickly relieved by a tracheotomy. Diphtheria also damages the heart, the brain, and the kidneys. Diphtheria germs produce powerful toxins or poisons which damage nearby cells and even affect distant organs, such as the kidneys. The toxins are carried to these areas by the bloodstream. Heart failure may occur because the muscle fibers become weakened and are unable to contract as they should. Course of the disease: diphtheria begins with a sore throat within a few days after the patient has been exposed to the disease. A grayish membrane forms in the throat, and there is pain and diff. 226 Infectious diseases. Difficulty in swallowing. Soon the child becomes dangerously ill with a high fever, and breathing may be obstructed because of the swelling in the throat. Large tender glands develop in the neck, and the ears may be tender and inflamed. Pneumonia and bronchitis are common, but the most dangerous complication is myocarditis, or inflammation of the heart. The nerves of the throat may be partially paralyzed, and the kidneys damaged, sometimes permanently. Treatment: all young children should be protected against diphtheria by means of DPT shots, as suggested on page 188. In case of an epidemic of diphtheria, all children under 2 years of age should be given antitoxin without delay. Patients with diphtheria should be kept in bed and isolated from the community, preferably in a hospital specializing in the treatment of contagious diseases. Tube feeding and continuous oxygen may be necessary in the more severe cases. Penicillin and erythromycin are of value in treating the complications. The patient should remain in bed for several weeks, and should not be allowed up until the electrocardiogram has returned to normal. Recovery is often slow, particularly when the heart is involved. Large doses of vitamins B and C are advisable in all such cases. Scarlet fever. Scarlet fever or scarlatina is a contagious disease caused by certain streptococcus germs, usually located in the throat. The disease is transmitted by coughing and by contact with contaminated articles including food and milk. When severe, scarlet fever may last for 2 weeks, and may be followed by tonsillitis and ear infections. Scarlet fever is more common in densely populated areas. It occurs more frequently at the end of the cool season. Most cases occur between the ages of 2 and 8 years. Course of the disease: patients with scarlet fever usually complain of headache, sore throat, weakness, vomiting, and fever. Small children may have convulsions. The face is flushed, but there is a pale area around the mouth, known as circumoral pallor. In the throat there may be a yellowish-gray membrane. 24 hours later a diffuse pink rash appears on the neck and chest, which later spreads to the abdomen and extremities. The skin has a rough and sandy feel to the touch. In darker-skinned people the palms and soles may be the only places where the rash can be identified. Milder cases are frequently not recognized, except for a sore throat. 228 infections of childhood and youth. More severe cases should be treated in hospital. In patients who are severely ill, the germs of both diphtheria and scarlet fever may sometimes be found together. After 2 or 3 days the high temperature begins to come down, but there may be some fever as long as the throat is sore. The rash usually subsides after 3 or 4 days. Recovery is slow, often requiring up to 4 or 5 weeks. Complications may be serious, particularly when the ears, the heart, or kidneys are involved. Rheumatic fever and nephritis sometimes follow scarlet fever, particularly if the child is allowed up too soon. Treatment: isolate the patient to protect the community. All cases of scarlet fever should be carefully quarantined or sent to a hospital specializing in the treatment of communicable diseases. All persons who have contacted the scarlet fever patient should be given penicillin or some other antibiotic daily for at least the next 5 days. If desired, a longer-acting penicillin can be used, in which case only 1 injection may be necessary. Good nursing care is most important in treating a patient with scarlet fever. Penicillin should be given daily. Some other suitable antibiotic, such as tetracycline, may be used if the patient is allergic to penicillin. Sulfa tablets and terramycin have also proved effective in treating this disease. The patient should be kept in bed, and given a soft or liquid diet, see appendix. Alcohol sponge baths and other cooling measures as suggested on page 232 may be used to bring down the fever and make the patient comfortable. Applications of cold cream or oil lotions are helpful in controlling itching. Be sure to keep the patient in bed until the doctor is certain all signs of the disease are gone. Rheumatic fever. Rheumatic fever or inflammatory rheumatism is a very serious disease that mainly affects children and young people in their teens. It is thought to be an allergic condition that attacks the connective tissues of the body, causing joint pains and st. vitus dance due to central nervous irritation and skin lesions. All these are more or less temporary. The really serious part of this disease is the damage it does to the valves of the heart. Certain streptococcus germs present in the throat are apparently responsible. The body becomes highly sensitized to their presence, and it is this allergic response that harms. Rheumatic fever 229. In most cases the child first develops a sore throat. Several days or weeks later he may have a fever with aching in the joints, a lack of appetite, profuse sweating, and perhaps even a rash. No two cases are exactly alike in their manifestations. This often makes the diagnosis difficult and uncertain. If there is any doubt, it is best to carry out the treatment outlined here. Rheumatic fever seems to run in certain families. If both parents have had the disease during childhood, their children are more likely to have rheumatic fever. Wherever large numbers of children and young people are gathered together, there is always the likelihood of rheumatic fever. Overcrowding, malnutrition, and dampness often play a part. Small outbreaks of rheumatic fever may occur in army barracks. 2 out of every 100 children in school are likely to have some form of rheumatic heart disease. Rheumatic fever causes more deaths during the first 20 years of life than all other infectious diseases added together. These are facts no parent can afford to forget. Rheumatic fever strikes children in every part of the world. Course of the disease: rheumatic fever usually strikes first in childhood, around 8 years of age. The child comes down with a sore throat or cold, followed by an attack of tonsillitis or perhaps scarlet fever. While he is recovering from the infection, 1 or 2 of his larger joints become red, swollen, and tender to the touch. There is also soreness in the muscles and tendons, as well as lack of appetite and a feeling of weakness. Tender nodules may appear on the skin, particularly over certain joints such as the elbows. Nose bleeding is common in rheumatic fever, even when there has been no injury. Pains in the chest probably mean that the inflammation has reached the pericardium and the heart muscle itself. The child may develop pneumonia, pleurisy, and even abdominal pain resembling acute appendicitis. The patient may become fidgety owing to Sydenham's chorea, or St. Vitus dance. This is more common in girls but also occurs in boys. Hand movements may be rapid, jerky, and irregular, and the patient has a tendency to drop things. There may be muscle weakness and even some difficulty in chewing and swallowing, particularly in younger girls. Not all cases of rheumatic fever are this definite. In some children the disease may be of a low-grade, smoldering type with 230 infections of childhood and youth. Few definite signs. But the child is not well. He is easily fatigued and may not gain weight as he should. He may have a persistently rapid pulse rate and low-grade fever, continuing for long periods of time. The child may complain of growing pains. This means an aching pain in the muscles and joints, and perhaps over the heart. Such complaints must be taken seriously. The child should be put to bed and kept there till he is well and strong again. School is much less important than his future health. Special tests: unfortunately we have no specific tests for rheumatic fever. The diagnosis can be made only after a careful study of the patient's history, physical examination, and all the laboratory findings. In most cases both the white blood count and the sedimentation rate are well above normal. The C-reactive protein test may also indicate the presence of inflammatory disease. Other tests, including the anti-streptolysin or AST test, may also be elevated. Special smears taken from the back of the throat may reveal the presence of streptococcus germs, but all these tests are only indicators of infection. Another important test is the electrocardiogram, although in some cases it may remain normal. Any disturbance in the normal tracing may indicate some interference in the conduction of electric currents through the heart muscle. Changes in the T waves are also significant, especially in a child suffering from joint pains and fever. Such findings must always be seriously considered. The child must be kept under good nursing care until the electrocardiogram has returned to normal. X-ray studies of the heart may show that organ to be dilated. During later stages of the disease, the X-rays may show marked changes in the shape of the heart because of damage to the mitral or aortic valves. Rheumatic heart disease and its special treatment, including surgery on the valves of the heart, are more fully discussed on page 244. Heart murmurs are common during rheumatic fever, but may disappear entirely when the disease clears up, provided the patient has been properly treated. But if the valve cusps are badly damaged, murmurs may return years later as the valves become progressively more deformed. No patient who has had rheumatic fever may be considered to be free of heart disease until he has been observed over a period of many years. The more careful the immediate treatment, the less likelihood of complications later on. Treatment of rheumatic fever 231. Prevention. Rheumatic fever can usually be prevented by treating all patients who have sore throats or other streptococcal infections in the community, and especially in the home. Penicillin is still the best medicine for severe sore throats. If the patient is sensitive to penicillin, tetracycline may be given. The choice of medication must be made by the physician in charge. Patients who have had rheumatic fever or rheumatic heart disease should be given penicillin or some other medication regularly for at least the next 20 years, or preferably for life. Treatment. Keep the patient in bed until all evidence of rheumatic fever has disappeared. This may take several months or even a year. The patient should be kept as quiet as possible. Take his temperature once or twice daily. When he feels better, and the temperature has returned to normal, he may be up and about for limited periods each day. But any strenuous exercise should not be permitted for at least 1 year or longer, depending on his condition. Good nursing care is always the secret of success. Note carefully the condition of the skin, using rubbing alcohol or some similar preparation to keep down irritation. A heating cradle, such as described in the appendix, is beneficial in treating swollen joints. In severely ill patients, the fever may be very high. Absolute bed rest is important in such cases. Medications. Most doctors give some form of salicylate, such as aspirin, several times a day to relieve pain and reduce the fever. Always give the medicine with a little milk, because salicylate tablets tend to burn the lining of the stomach. In the more severe cases, cortisone products or sulfadiazine are of value. ACTH may also be used. Penicillin helps to clear out the hemolytic streptococcus germs from the throat. The more severe cases are best treated in hospital to prevent further cardiac damage. Some may require oxygen and other medications to help the circulation. Diet. Liquid and soft diets are preferred in the early stages of rheumatic fever. The patient should be given plenty of water and other liquids, especially if he has a high fever. Keep him in bed in a quiet, restful environment, preferably at home. Some mild sedation may be needed if he is nervous and jittery, for it is most important to keep the patient quiet in order to protect his heart from further damage. As long as there is a high white count, an elevated sedimentation rate, or changes in the electrocardiogram, the patient F16. 232 infections of childhood and youth should remain in bed. He should be seen frequently by his own physician. With proper rest and the right kind of care, even the worst case will soon improve and may even make an almost complete recovery. Infectious mononucleosis. Infectious mononucleosis, also known as glandular fever, is most likely to occur among teenagers and young adults. The cause of this disease is still not definitely established. During the first few days, the patient complains of fatigue, headache, chilliness, and feelings of weakness. Later, the lymph nodes in the neck, under the arms, and in the groins become enlarged and tender. Then the patient develops a high fever and a sore throat, and may also complain of soreness in the abdomen on the left due to enlargement of the spleen. The tonsils may be enlarged, and there may be tenderness over the liver, similar to infectious hepatitis. In more severe cases, there may also be pain over the heart, due probably to pericarditis. Virus pneumonia may be another complication. The diagnosis of infectious mononucleosis, or glandular fever, can be established only by having a complete blood count and other tests. In this disease there is a marked increase in white blood cells, and many abnormal lymphocytes are also seen. A heterophile agglutination test may be needed to confirm the diagnosis. This disease usually continues for a month or 6 weeks. It is serious, but rarely fatal. Treatment: keep the patient in bed, especially during the peak of the fever. Give plenty of water and fruit juices. Some mild medications such as aspirin, 5 grains every 4 hours, will help to lower the fever and keep the patient comfortable. Children need correspondingly smaller doses. If the temperature rises to 106 degrees or 107 degrees, wrap the patient in a wet sheet and pack ice around him until the fever comes down. Rinse the mouth frequently with some good gargle or antiseptic solution. Penicillin or sulfa tablets are useful in treating tonsillitis and sore throat. Hot packs, as suggested on page 91, may be applied to the chest and spine. But care must be taken to avoid heavy pressure over the abdomen, for this may rupture an enlarged spleen. Keep the patient in bed for at least 3 or 4 weeks. A sore throat may be relieved by using a heating compress, as outlined on page 95. Good nursing care is most important in this disease. Most patients recover without any serious complications,